Well, good afternoon, everyone, and I'm joined again today by Mayor Lori Lightfoot and by Illinois Department of Public Health Director Dr. Ngozi Ezike. We also have two special guests with us, Brad Cole, the former mayor of Carbondale, who's also now the executive director of the Illinois Municipal League, Tim Dre, who hails from Taylorville, born and bred there, and is the president of the Illinois AFL-CIO. And we are joined once again by Dr. Allison Arwady, the director of the Chicago Department of Public Health. To the thousands of people across the state who have been joining us every day via live stream, welcome back. And to anyone joining for the first time, thank you for your desire to get factual information on what's happening here in Illinois. To our reporters, thank you for your commitment to truth and accuracy. Folks, I know that this journey is an extraordinarily difficult one, personally, financially, emotionally. I know that when I signed our disaster proclamation on March 9th, when restaurants and bars closed on March 16th, when schools suspended on-site learning on March 17th, when the stay-at-home order took effect on March 21st, well, each step we have been forced to take by this pandemic has made things more challenging for our residents. The cascading consequences of these steps weigh on me every minute of every day. But as I've said since the beginning, my priority through each and every one of these decisions has been and continues to be saving as many people's lives as possible. That's the one goal that I will put above all others every time. Most critically, I have let the science guide our decisions. I've relied upon the top medical experts, scientists, public health researchers, epidemiologists, mathematicians, and modelers from the greatest institutions in the world, like the University of Illinois, Northwestern University, University of Chicago, SIU, and others whose guidance on infection rates and potential mortalities and protective measures is frankly second to none. It is based upon that advice that tomorrow I will be signing an executive order to extend Illinois' disaster proclamation, our stay-at-home order, and our suspension of on-site learning at schools through the end of the month of April. If we can end these orders earlier, I'll be the first one to tell you when we can start to make strides toward normalcy again. But that time is not today, and it's not April 7th. Illinois has one of the strongest public health systems in the nation, but even so, we aren't immune to this virus's ability to push our existing capacity beyond its limits. We need to maintain our course and keep working to flatten the curve. Here's what we know. As of March 30th, our preliminary reports from hospitals statewide show just 41% of our adult ICU beds are empty, staffed and ready for immediate patient use, a 2 percentage point decrease from the moment in time numbers that I ran you through last week. And 68% of our ventilators are available statewide, a 4 percentage point drop in a week. That doesn't mean that every hospital has that availability, but collectively, that's what we have across the state. Statewide, about 35% of our total ICU beds are now occupied by COVID patients, and about 24% of our total ventilators are occupied by COVID patients. We're still within our capacity, and we're working every day to acquire new ventilators or convert alternate use ventilators to increase that capacity. But from all the modeling that we've seen, our greatest risk of hitting capacity isn't right now, but weeks from now. The virus's spread is growing. So are its risks. We must not let up now. I'll remind everyone that these interventions don't work if they're piecemeal across the state. It was only a few weeks back when we had just a handful of cases, all in one county. That's up to 5,994 across 54 counties. And we know that there are even more people out there who have contracted COVID-19 and already recovered without realizing it, or recovered at home and never qualified for a test. That's true in all 50 states, and that's the price that we will continue to pay for the lack of early, robust national testing. So we have to stick to the knowledge that we have. No community is immune. To that point, I want to discuss our efforts to keep our Department of Corrections facilities as safe and socially distanced as possible to minimize the spread of COVID-19 within those facilities. Fortunately, DOC is at its smallest population since 1995, and it currently has 36,944 individuals. That's 1,069 fewer prisoners than on February 1 of this year. On March 14th, early in the process of my issuing executive orders addressing COVID-19, to reduce the spread of the virus, DOC suspended all visits, moved all facilities to administrative quarantine, and ensured access to hand sanitizer and cleaning supplies to all staff and incarcerated individuals. IEMA and IDPH have made multiple deliveries of personal protective equipment to the Department of Corrections, totaling over 160,000 N95 masks, over 200,000 surgical masks, and tens of thousands of gloves, and DOC is sending an additional shipment to Stateville today. DOC has been reviewing the case files of as many low-risk offenders as possible for early release during this crisis, with nearly 300 more released as of 1 p.m. today. This has included some of our female inmates who are pregnant or were in our Women and Babies program, as well as low-level offenders at the end of their sentences. All have been thoroughly vetted to make sure that there are no histories of violence, and particularly domestic violence, and all had homes to return to. I should note that places to reside for exiting offenders are one of our greatest challenges. We need to ensure that each person released in this manner has a place to return to, and those arrangements are more difficult for exiting offenders during these challenging times. We're working hard to balance the need to free up as much space in our prisons as possible with making sure that we're not releasing those who may pose a risk to their communities. Every step we take with regard to our prison population needs to solve an existing problem, not create a new one. I signed an executive order to suspend the daily flow of convicted transfers from county jails into IDOC facilities. And my office is working with the Department of Corrections to review the histories of all of our inmates to prioritize the release of older and more vulnerable residents while ensuring the public safety. Under the order, the director still has discretion to accept transfers from county jails when necessary, and he will exercise that discretion. Tragically, we have lost one patient to COVID-19 at Stateville Prison, the maximum security prison that's closest to the Chicago area, with 32 total positive cases among those in custody and more results pending. We have 18 staff members who have tested positive who are employed at various Department of Corrections facilities. The DOC is working diligently to prevent further spread by requiring all staff on duty to wear personal protective equipment and by opening parts of the facility that were closed to allow for further social distancing. We're using every mechanism available to us to prevent and contain the virus's spread in our Department of Corrections facilities, including standing up temporary facilities for an on-site medical mission with our National Guard. But I want to be clear, despite these measures, and any and every one of our DOC residents who falls seriously ill with COVID-19 will receive available medical assistance to get through it, including an ICU bed and a ventilator if necessary. An incarcerated person is a person. And my administration will not be in the business of claiming one life is worth more than another. I want to say to the local hospitals that are near the prison facilities, we will do all that we can to ensure that any patients receive the best care that we can provide, and we will work with local departments of public health to get you all the equipment and support that we can. But hospitals that refuse to take on residents of the Department of Corrections will be called out by name. And those that refuse to operate in accordance to their oath can and will be compelled to do so by law. We are asking everyone during this extraordinarily difficult time to do their part to keep residents, all residents of Illinois, safe. We inherited a prison system that has suffered from overcrowding after decades of tough-on-crime policies focusing on punishment without attention to rehabilitation. Democrats and Republicans agree on this and have worked together over the last number of years to make real changes. And while we have prioritized support services for the men and women in our care, we're still operating in facilities that were not built to support these kinds of efforts. When we get through this immediate crisis, we all need to have a real conversation about criminal justice reform and the status and conditions of our state prisons. But I'll be frank with you, we still don't know exactly when this immediate crisis will pass. And I know this continues to be an extraordinarily difficult time for families across our state, especially for our workers. I have directed my governor's office staff and agency directors to do everything and anything in our power to help our residents who are hurting. We've directed tens of millions of dollars to support our small businesses in impacted industries and offered sales tax payment delays wherever we can. We've expanded support for individuals through the ban of residential evictions, a delayed income tax filing deadline, increased unemployment eligibility, and worked to expand our Medicaid and SNAP programs. There are countless unseen people in state government who are working behind the scenes day and night, 7 days a week, to find every possible mechanism to support our working families. And I promise you, we will not stop until this virus passes. Lastly, I want to talk about what this extension means for our students. Well, first and foremost, I want to recognize the creativity of our Illinois State Board of Education and the superintendents and the school districts all across our state for their remarkably able and agile efforts that they've demonstrated, providing learning opportunities, meals, connection, and stability throughout this crisis. Under this extended order, schools will transition from Act of God days to remote learning days. All of these days count toward the school year, and absolutely no days need to be made up. Each district is working with ISB to create and implement a remote learning plan to ensure that all students, including students with disabilities and English language learners, receive instructional materials and can communicate with their teachers. Remote learning will look different for every district and maybe even for every school. School districts will create plans based upon their local resources and their needs. ISB recommends any grades that schools give during this time be used as feedback and not as an instrument for compliance. Students are going through a situation over which they have no control. Our first response must be empathy. I want to end with a message for our students who I know never envisioned a pandemic derailing their spring semester. Believe me, as a parent of 2 teenagers, you're not the only one. I won't try and tell you that texting and calling each other is the same as hanging out in the hallways or in the lunchroom. And I won't try and tell you that a Zoom prom is the same as a real prom. I won't try and tell you not to be sad about the lost goals and plans that you may have had for March and April. It's okay to be sad. And if you do feel sad or frustrated or angry, whatever you feel, please let yourself feel that way. Don't beat yourself up over being human. And if you're experiencing overwhelming anxiety or you have a friend who is, and you need someone to talk to. There are resources available to you by phone and online through both ISB and our Department of Human Services, as well as the City of Chicago. But I also want to say something else. Once you're ready, take a look around. Take in the incredibly unique moment that you're living in. Yes, it's scary, and it's uncertain, and it's difficult. But if you're looking for a lesson in the fundamental goodness of people and of your community, it's right there in front of you. Take a look at the districts across the state that have taken it upon themselves to support our healthcare workers, like Tinley Park High School's science department delivering goggles to Advocate Health's Christ Medical Center, or Decatur Public Schools donating over 200 iPads to promote contactless communication at area hospitals. Maybe those are your teachers and administrators, or maybe your school is one of the many that have made donations. Even if it's not, I bet people in your school are finding a way to help. Be one of those people. Or look at Michael Arundel, an Orland Park native, home from college while classes are out at the University of Alabama, where he's studying to go to medical school someday. He came home and he saw a need where his elderly relatives and neighbors were afraid to go to the grocery store. So he filled that need by creating Leave It to Us, his free service to go grocery shopping for senior citizens. Orders took off, and his network of mostly college-aged volunteers is now launching service in 5 other states nationwide. Michael, thank you for your movement, the movement that you have started. All of Illinois is proud of you. And I want to encourage our elderly Chicagoland residents, as well as healthy young people across the state looking to join Michael and start a local branch of their own, to visit his website. It's at covidseniorshoppers.com. covidseniorshoppers.com. And most of all, look at the people who make up our healthcare workforce, our doctors, our physician's assistants, our nurses, our nurse practitioners, yes, but also our hospital social workers, EMTs, pharmacists, our ER technicians, registration staffers, sanitation services, and the food service workers who keep patients fed. Maybe you call one of those people a parent, a sibling, a cousin, a friend. Maybe someday that'll be you. I can tell you that they didn't join this profession looking to fight a pandemic. They wanted to help people, to live a life of service. And they're doing that still, even though they share the fear and uncertainty that we all do. No, it's not the school year you bargained for, and I'm terribly sorry for that. But amidst these dire circumstances, I want you to know that there are plenty of people to learn from. There's plenty of reason to hope. And if all else fails, I've heard that Where's Lightfoot meme page is a good place to go for a laugh.